Okay. Good morning, everybody. And want to just model our new awesome One Albuquerque face masks. So thanks so much to some friends and family who put a few of these together. And we'll hope to make more. But I know, especially so people can understand and hear what I'm saying, I'm going to go ahead and take it off now. But we'll be using it from here on out. So very cool. So we are, of course, doing our daily briefing at 11:30. Good morning. And we have a couple of topics we're going to cover today. The big topic is we're going to talk about equity in our city and all things related to Corona and equity. And so we have a couple of special guests here that we're going to talk and introduce, especially our Director of Equity and Inclusion, Michele Melendez. And then we also have some technology that's helping us map out and sort of analyze some of these issues. And so RS21 is here as well with Charles Rath. And he's going to be talking about a new tool that we have available as well that they've been making for us and other cities all around the country, actually. So let's begin with some updates from our Joint Information Center. So first, I want to let folks know that the U.S. Small Business Administration's Paycheck Protection Program has resumed accepting applications this morning. And so this is a great thing. This is part of that second stimulus package. You can also contact any of our local banks for more information on that, or look at the Small Business Administration's website, which is the state version is nmsbdc.org. Okay. Also, it was announced earlier today that the One Albuquerque Fund donated another $50,000 to the coronavirus response. I want to thank everyone who's donated to that. There's been $10,000 actually of money that came in, and now in total, the One Albuquerque Fund has donated $100,000 to motel vouchers, housing vouchers, and the Small Business Relief Fund. So we're going to be able to fund a few more of those small business grants that we talked about a while back to help keep them afloat because of the efforts of the One Albuquerque Fund and, of course, everyone who's donated into that. So I want to thank the donors, big and small, and the fund leadership for doing that. And who would have thought this fund would be so desperately needed? I'm so glad we have it, and I'm grateful for their efforts and everyone who's supported it. And again, that fund is you can see it or donate to it at onealbuquerquefoundation.org. Okay, let's start with our deep dive topic today. And I want to begin by stating that, during the COVID-19 response in Albuquerque, as we always try and do, we try and view everything we're doing through an equity lens. That's something that our administration has been working on since we started. And in this context, it's been really trying to understand that safety net and those most vulnerable during the corona epidemic or pandemic. And all across the U.S., we know there's been a terrible disproportionate burden of illness and death among racial and ethnic minority groups, and also our most vulnerable in terms of their health condition and their age. We also know that right here in New Mexico, despite being the Native American population being about 10% of the state's population, we know that that's about 50% of the COVID cases. And, this is for communities of color that are hit hard by this virus. This is, of course, really just a reflection of the long history of systematic and institutional discrimination against the underserved. This is something that's been with us a long time, but this virus has highlighted these cracks and, in fact, broadened these cracks in our society. And it's a reflection of decades of structural racism that have preceded this public health crisis. Now, this is something, when you combine the economic and social conditions that have paved a road towards inequity, we get these kind of inequity readings when it comes to the data that we're seeing for COVID. And so for us, we're trying to do what we can with respect to this. Again, it's a national issue. It's a deeply rooted historical problem, but it's also a problem in the time of Corona. So locally, we've been using this equity lens first to listen to different groups that are impacted, and then also try to understand that different populations, different neighborhoods are impacted different ways. So we're trying to have different solutions for those populations and neighborhoods. So before the coronavirus, we had fortunately created our city's first Office of Equity and Inclusion and reinvigorated the Office of Civil Rights that have really targeted responses and resources to neighborhoods that have been left behind. And during this public health crisis, we continue to do that by providing those safety nets in those same neighborhoods and for those same populations, again, most vulnerable. This means a wide range of things that we're going to talk about today, but it also includes language access, it includes making medical care available, it includes our homeless population, and it includes our senior population. And so we're going to talk more about this with our Director of Equity and Inclusion, Michele Melendez, and also look at some of the information and data available through RS21. But before we do that, I do want to introduce our special guest that we have here with us today. Representative Melanie Stansbury is here with us, and she's been working on a couple of different initiatives during this time, and we're fortunate to be able to have her today. So I'm going to go ahead and introduce Representative Melanie Stansbury. Representative?
All right. Well, thank you, Mr. Mayor, and thank you for your incredible leadership during this time. And I want to thank all our first responders and our frontline workers and everyone who's out there working on the front lines right now, and especially to all the families who've been impacted by COVID-19, whether that's through health or through economic hardships that you're facing in your family or your community. My heart really goes out to you. So, Mr. Mayor, I think you really highlighted one of the big issues that we're seeing right now with this both public health crisis and economic crisis, which is that our communities and our systems are being strained like never before. And certainly those strains were already there, and we saw those cracks, as you put it, in our food system in particular, and the food deserts and the food insecurity that we have all across our state, and income insecurity that we have all across the state and in our communities. So over the last year, myself, a number of other legislators, the governor's office, community leaders, our food banks, and nonprofit organizations have been convening a food and hunger and agriculture work group to try to address some of these structural issues around our food system. And New Mexico has one of the highest food insecurity ratings of anywhere in the United States. So 1 in 4 children in New Mexico experiences hunger every year. And as we're seeing this public health and economic crisis, we're seeing those systems be strained like never before. So our policy group, which had been convening since last summer, reconvened about a month and a half ago. And since then, it's been transformed into a kind of emergency response effort that includes all these different parties trying to make sure that we can keep all of our food pantries and our food banks operational, to deploy resources to address food supply issues, and make sure that we're getting food and water to communities in need. And I think one of the things that we're seeing during this time is the way in which particular communities, because of those structural inequalities, are under particular strain. And as a result of that, part of our work has been over the last month to help create a Native American Relief Fund, because as many of you know out there, for example, there are a number of chapters on the eastern side of the Navajo Nation where many people live off the grid and they don't have immediate access to wells or water in their home. And so under normal conditions, they would go and actually fill up water tanks or water jugs and bring that home. But because of closures and public health issues, we're seeing a huge crisis all across our Dene communities around getting water to communities, particularly in rural areas. And we're also seeing in our Pueblo and our Apache nations the need to take public health precautions and help to get food to whole communities. And so that's why we set up with the state and a whole slew of different parties, including philanthropy, nonprofit organizations, tribal organizations, this new fund called the Native American Relief Fund. Now, there's a lot of funds out there, and all of them are important. They will all serve our communities, and so please give to them all. There's also a Pueblo Relief Fund that's been set up by the All Governors Council, as well as a number of Navajo focused relief funds, including one set up by the Navajo Nation and the Navajo Hopi GoFundMe site. So all of these are important ways in which you can give back. Please support our food banks. We're seeing all across New Mexico that our food system is really strained by a lack of volunteers and also national food supply issues. And so the costs of feeding our communities are going up. Here in Albuquerque, the Roadrunner Food Bank is the central hub for central New Mexico and helps to supply our food banks all across the state. So helping Roadrunner Food Bank or the Food Depot in Santa Fe, you're helping communities all over the state of New Mexico keep their doors open. Right now we have about 16 to 18 food pantries and meal programs across the state are closed, and that's families that are not being fed right now. So please give what you can to the food banks and to our food pantries. If you don't have any risk factors and you can volunteer in a warehouse to help package box food to deliver to families, that's another way that you can give back. And please also give to the Native Relief Fund. It's at the New Mexico Community Foundation. So you can find that at nmcf.org. And you can make a personal donation, you can make a corporate donation, and that money will go directly to communities to help bring water, food, medical supplies, and anything that grassroots organizations and tribal governments are doing to help serve communities on the ground. So I hope all of you are well, and I'm sending my best to you all, and I'm going to turn it back to the mayor for our next guest, and I really appreciate the opportunity. So thank you.
Thank you so much, Representative, and all the different folks that you're working with. And we really appreciate, the individual attention, actually, that you've paid and the other representatives that you're working with to these issues during this time. And as we think about recovery, too, all of these organizations and funds are going to have a huge part, I think, for many, many months to come. And so that's another reason why I wanted to share it with you today. Now, I want to talk a little bit more about sort of the connection between race and ethnicity and some of the things that we're seeing. At the city level, we have tried to be clear, first and foremost, that we will stand up against any hate crime or discrimination that is occurring during these times, as we would always, but especially now. And if you have that, we can take reports through the 311 system. I also want to mention that Albuquerque, by far and away, has done a very good job with this. We have had, again, much less of these issues than I think anyone expected, and that's awesome. It's a reflection of that one Albuquerque spirit. But I also want to make sure that everyone has access to services. And that's why we've made sure that regardless of immigration status, there's a no documentation barrier or limited documentation barrier to all city services. That's something we've been doing from the beginning. We also set up our Native American Affairs team. We wanted to limit the number of people in this room, which is, and some folks had some travel schedules and so forth, so they're not all here. We're just going to let Michele talk and also a couple of other folks from the office, but I want to let you know that we're grateful for Dawn Begay and the work she's doing, as well as Terry Sloan in our Native American Affairs office. That was a team that had been around in its infancy for a while, but now we have 2 full-time employees on it. We have had for the last year, and it's really helped, especially with some of the challenges that have been hitting the Navajo Nation that are on our borders. So with respect to especially To'Hajiilee and the need that they had for food and so forth, and the programs that we set up, we actually picked up 2 truckfuls so far of food for To'Hajiilee, again, put together through Alan Armijo and our Native American Affairs team. So really appreciate their work on that. I'm also in direct communication with our Pueblo governors, the ones that surround us, and have been checking in with them and making sure that they have all the support that they need so far. Now, we've also been working on language access. We've been trying to have bilingual town halls. We've done Spanish, Vietnamese. Councillor Lansen has done a great job putting those together. We've also been having internal leadership calls with a lot of organizations, especially those who deal with our immigrant and refugee community. And again, we're going to hear a little bit more about that when Mariela Ruiz-Angel comes up to discuss the Office of Immigrant and Refugee Affairs work. Now, I want to mention a little bit around vulnerability. This is something that is also very, very important for respect to our most vulnerable population, which of course is our homeless population when you really get down to it. And that's a population that we continue actually to have screening and testing at our West Side shelter, and we also continue to provide those critical housing vouchers. So we know that the homeless population usually goes way up in the summer, And we expect that, and now, of course, it's even more of a challenge. But so far, because we have that medical presence out at the West Side Shelter, as long as we can get people into one of our systems, it could be HopeWorks, it could be Heading Home, it could be Healthcare for the Homeless, or what the city does directly, we're able to get them the help that they need and offer the screening that they need. And so it's very important that we continue to try and do that. We're also trying to work with our ADA community with respect to keeping Sunvan open. We've done a good job of doing that. We're also trying to work on those infrastructure updates. There's 1.2 million in ADA improvements that we're doing around the city, sidewalks, ramps, and so forth. I think Rio Grande started today. And these are all things that we hope will help. And we're also trying to make all our fire stations ADA compliant. Now, what I want to do is actually hand it over to some of the experts on this. And so here to talk more about our equity initiatives is our Director of Equity and Inclusion, Michele Melendez. Now, I do want to mention she does have experience as a public health professional as well. Actually spent time at the Department of Health working on emergency preparedness, which is also why we're fortunate she has a nice team that can do this, because we've been using her expertise out at our own Emergency Operations Center. So she has a ton on her plate right now, including overseeing our system of alternative shelters that can alternate care for the most vulnerable populations. Michele, come on up.
Thank you, Mayor, and thank you for inviting us today to give an update. As you said, we have a very strong system in place to make sure that anyone who feels like they're being discriminated against or stigmatized because of this disease has a way to make that complaint through the 311 system. And we came out very early and very strongly against stigma, knowing that this disease does not discriminate, and neither should we. And we updated that anti-stigma campaign last week to really include the Navajo Nation and any other Native populations that are being heavily impacted by this disease, not because of anything that they have done, but because of that structural racism and structural inequity that we have seen in our country for many decades. So I wanted to say that because of my public health background, I've always seen poverty as a public health issue. And now, because of this pandemic, we're really treating poverty as an emergency and treating it as a public health emergency, knowing that by asking people to stay at home so that we can really curb this transmission of this disease, we needed to be able to provide these community lifelines for folks, to provide for basic safety and security, food and water and shelter, hygiene and utility assistance, communications and connectivity so that we can keep in touch while we're home, and of course public transportation, and then the health and mental health needs of our community. And in order to do that, we have used our powers as a city and our Emergency Operations Center to quickly address the needs of people who are not going to be getting stimulus checks because they might be left out for various reasons because of their immigration status, and yet the rent is still going to come due. And so the way that we can help is to provide food and assistance with maintaining their housing and not being evicted so that they don't end up homeless and end up at further vulnerability. And so those supports have largely been provided in close coordination with the school district, and now all together as a community of the city of Albuquerque and the schools, we have prepared and provided more than 435,000 meals, and of those, 66,000 provided by the Department of Senior Affairs and Family and Community Services alone. And those are efforts to try to keep people safe and well in their homes. As well, we knew that there might be barriers to accessing testing and healthcare. And so we know that our partner in University of New Mexico Hospital provides, and others do, provide free testing regardless of immigration status, and no insurance is needed. And we also wanted to make sure that people know that they can be treated at our state's public health hospital if they need treatment in a hospital for COVID-19 at no cost to themselves. And that's a function of being a public health hospital. And so we wanted to remove that financial barrier and that fear that people would have that taking advantage of these free testing and services would negatively impact them in their immigration status. And so those are things that we're very aware of, because we've always known that people who are trying to get immigration status in this country are afraid of being called what's called a public charge. And we don't want that to be a barrier for people to take care of themselves and their families in the middle of this disease. Another one of the main things that we've known by being in close contact with our community is that not everybody has Wi-Fi. Not everybody can take care of their kids' school needs from home. And so we've just been thrilled that the city has been able to help provide this mobile Wi-Fi at 20 or more of the places where school lunches are also being provided. And that's just a huge asset to the community that provides for that connectivity that we know is needed. As well, when we speak about the hygiene and housing needs, the city has put up 18 porta potties throughout the city, knowing that all of the public buildings have been closed to the public, and that closed an important resource that we didn't know, that we knew would be a big impact. As well, we have set up 3 satellite shelters, homeless shelters, and then places for people to self-isolate if they don't have a place to isolate at home if they're impacted by COVID, either being exposed or having been tested or being positive with the disease. As well, we've been very, very focused on workers' rights and protecting those workers, because there are many people who are essential, who are the hotel housekeepers, they're the orderlies at the nursing homes, they're the janitors, they're the dishwashers. So our environmental health department has really made sure that really good training and resources are available for them so that those workers can be as protected as they can while they continue to provide these essential services. And again, I just want to thank the mayor and thank our Native American Affairs team for being such close contact with the urban Indian population and our neighboring tribes and our Navajo Nation counterparts, so that we know what needs the city of Albuquerque can help meet and what those needs are for the populations living in Albuquerque. And I also want to thank the whole rest of our team for equity and inclusion, who have all teamed together to make sure that we're getting the word out to parts of the population that may not be on social media, may not be watching the news or these live feeds. So using every resource that we can in our direct communication with groups in multiple languages so that everybody has access to these life-saving resources that can help them be stabilized during this important time. So thank you for making this available to us.
Thank you so much, Director Melendez. We also want to talk a little bit about these impacts on our immigrant and refugee community. And so we're also joined by Mariela Ruiz Angel, and she's going to go into some of the impacts on that community.
Thank you, Mayor. Appreciate it. I'm Mariela. I'm with the coordinator of the Office of Immigrant and Refugee Affairs. And we knew that when this pandemic happened, one of the biggest issues that we were going to have was making sure that we got COVID-19 information to all residents. And all residents means even residents who don't speak English and don't read English. And so one of the things that we have really focused on in our office is making sure that we, with administration, recognize and find vital documents that need to be translated into multiple languages. So you can find that online now. We are constantly trying to keep up with those and making sure that, again, that we provide them not just online, but that we make sure that we find creative ways to get that information to families. Additionally, in partnership with Councilor Lancena, we have been able to provide a couple now, and every Thursday going forward, a bilingual town hall in Vietnamese and one in Spanish. Those start at 4 and then another one at 6 p.m. And this is a time that we allow for have different leaders in our communities who can address issues like domestic violence and unemployment and public charge to be addressed and then to be viewed Facebook Live so that we can have interaction from our communities. So I appreciate Councilor Sena for taking the lead and letting us be a part of that. Additionally, as you know, we have a Twitter account, at Alcalde Keller, where you can find a lot of our other kind of information, not just COVID-19 information, in Spanish. And that's been a huge, huge initiative that we've done even before COVID-19. And I have our ASL interpreter. So again, another way that we're being as inclusive as possible. Lastly, I really want to talk a little bit about the partnerships that we've had with our service provider, Valley Community Interpreters, the many immigrant and refugee partners that have really helped and guided the Office of Immigrant and Refugee Affairs and the administration in ways that we can be more inclusive, right? So we've worked really hard to even work with the Department of Health to create testing sites that are culturally and linguistically appropriate for our refugee and our immigrant communities. So that has been happening as well. But then also to be able to help fill some of these gaps. We know that the city is doing everything that we can to provide some of these direct services, such as food boxes and making sure that we give information around the eviction moratorium, but we know that there's additional needs, and I just want to really appreciate and say thank you to our community partners who have really been at the forefront with us, letting us know who needs to really be focused on, what kind of gaps do we need to fill. And again, I think Michele has touched on it, is that we are aggressively, for many of our undocumented and our mixed status families, we are aggressively looking for any sort of relief funding that we can assist with you in the future. So please know that that is something that we are constantly looking for. So thank you so much. You can always reach us, again, at 311. They will connect you to our office. We will continue to post out information in multiple languages. And muchas gracias.
Well, thank you so much for that. And I also want to mention the Facebook site for OIRA, that's ORYA, OIRA, for that. So if it's CABQ OIRA, that's where you can see, that's one way you can see the live streams of these bilingual town halls. And so that's kind of the platform that we've been using for those. We try and echo them as well, but you can tune in real time, 4 o'clock on Thursdays for those through that Facebook page, as well as everything else that Mariela's office is working on. Okay, with that, I think I just want to mention that, for us, part of this is also understanding what's happening in our community and then communicating the details with respect to where services are for folks who need them. And we're fortunate to be joined by the gentleman who runs RS21, and so I want to bring up Charles Rath, and he's going to explain what we're doing here on this website, but primarily right here, he'll walk through the pieces, but when we talk about internet access, so where our drive-up Wi-Fi locations are, and again, these are Sun vans that are pushing out internet to parking lots all around the city, where there's food distributions at APS sites, also where our public health centers are, and so forth. We want people to understand visually how close that is to your house. And of course, as we always do, we try to match services with need, so you'll see a connection there. And so also for our senior affairs team that is delivering meals, we've now done 65,000 meals to seniors in their homes. And there's also senior meal pickup sites. And so these are all things now we're able to display visually thanks to RS21. And so we're going to be adding additional layers for sort of hospitals and nursing homes and so forth. And so Charles is going to walk us through the material now available through his program and our website. Come on up.
Thank you, Mr. Mayor. I think on behalf of the other residents in Albuquerque, we're very inspired by your leadership during this time. I also want to say thank you to the nurses, the doctors, grocery store workers, other essential employees. You're the real heroes in this fight. So as Mr. Mayor mentioned, my name is Charles Rath. I'm the CEO of RS21. We are a big data company based here in Albuquerque. I represent about 60 very passionate data scientists and computer programmers that seek to tackle humanity's biggest challenges. About 5 weeks ago, when COVID really started to get on everyone's radar, our team galvanized and began looking at data as it relates to this particular crisis. One thing that we were particularly concerned about were vulnerable populations. That is the truly tragic thing about this virus. It affects disproportionately people that have underlying chronic health conditions such as diabetes, heart disease, COPD. It also affects the elderly. It also affects those that are having socioeconomic challenges as well. especially minorities, those in poverty. This virus is really tearing at the social fabric of our communities. So we developed a big data product. It is on the website covid.rs21.io/ABQ. And in this website, it does a number of different things. First and foremost, it provides a very robust listing of resources available to New Mexican businesses, families, individuals that are in need of services related to COVID. It also provides resources for folks that want to provide services or resources to those in need during COVID. The second thing the website does, as the mayor mentioned, is it highlights different services the city is providing as it relates to COVID. In particular, those meal distribution centers that are being rolled out in APS schools. The map provides those so you can get a real good understanding of where the closest one is to your particular home. We're also highlighting the Wi-Fi hotspots as well, which as you can tell from our map, which is highlighting those hotspots of urban health vulnerability, have been strategically positioned in the neighborhoods that need them most. So again, the website is covid.rs21.io/ABQ. I'll mention that we're very proud of the fact that we were able to roll this out in the 3 largest cities in New Mexico, Albuquerque, Santa Fe, and Las Cruces. But given what we've done here in our own community, our phone started ringing off the hook. And so we've now rolled this out to 500 cities across the U.S. To help mayors, public officials, faith-based groups, et cetera, help those that are most in need. So thank you very much. Again, the website is covid.rs21.io/ABQ. Thank you, Mayor.
Nice, and we'll just do a quick demo here on this. So the way this works, right now, the APS meals are tagged on here, and then you can just easily layer in, there's your hospitals, and then again, our nursing homes, something we're tracking as well, and then Wi-Fi access. And I do want to highlight for example, the Wi-Fi access we're going to move it a little bit depending on areas that need it and areas that don't, and sort of as that evolves. And APS meal sites have evolved as well. So what's also really important about these maps is you really should check them kind of the day of, because the Wi-Fi and the feeding sites might change, within a couple of days' notices and so forth. So that's just a little bit about the functionality.
Thanks, sir.
All right, thanks so much, Charles Rest. We're lucky to have you here in Albuquerque and, of course, helping so many cities around the country. Now, let's see. I want to mention, I think, primarily that for us, a reminder that, we have seen, unfortunately, there hasn't been a lot, but just as a reminder, there's been some myths around people of Asian descent being more likely to get COVID. That's absolutely not true. And again, same thing, we're hearing this myth now with Native Americans. Again, not true. Those are related to, there's underlying health conditions. But again, that is not, none of those are true. So our myth that we're debunking today is that connection. Now, this virus doesn't discriminate, and neither should we. So let me, with that, transition to our question section. With respect to takeout, which we always mention, I want to actually say did not do a lot of takeout because Ted Mascarenas, who we honored before, the man who makes enchiladas for first responders and healthcare workers all over our city, gave us some at City Hall here on Friday, and I ate them all weekend. So thank you so much, Ted, for the leftovers. All right, questions, and we're going to try a new system, by the way, where people can ask questions and we can hear them. So we'll just see how this works.
Okay, we have one from Iowa, and she said that they've been getting a lot of calls from people who need help paying rent. Many of them are either immigrant families or mixed families who didn't qualify for a stimulus check. It's been hard for a lot of them to get access to resources. What can they tell those families who need help either paying rent or getting other resources?
So the question is about how to get resources if English is sort of a second language or limited English capabilities. The city has ways you can do this, and so Also, because Univision asked the question, Mariela, if you want to also answer in Spanish, if you're up for it. It's okay if not.
Probably not.
Okay, so we're going to give you the English answer, and you can take it from there. So, but first, we do have some channels available, and we're making sure at the city level that you can access that. So why don't you go ahead and walk us through how that works?
So I think there was two parts to this, right? I think the first part was the limited English proficiency, right? So as we stated earlier, most of our information has been translated into Spanish. But again, a lot of the services that the city is providing right now are direct service, direct needs, right? Food and housing, right? Like temporary housing for homeless individuals. So I think what Univision is probably asking is around individuals who don't qualify for additional funding. And so again, I want to state I've been on multiple calls with partners and our administration to figure out how do we creatively and aggressively and also stay within our limits to be able to assist with those types of federal relief. Because that's what that's really about. It's asking, how do I get money to be able to pay my rent because they do not qualify. So just know that we are in conversations and we are trying to work with our state as well to also figure out how do we address this sooner than later.
Another question from Maida.
Did you mention the 4 locations, the public health ones? Okay. Also, I want to mention, remember, there's 4 offices of kind of last resort that are open. There's one in each quadrant. These are public health and social services offices. Most of them can connect to you if you're a Spanish speaker. So that's one place you can go if there's nowhere else you believe you can go.
Another question from Maida is, can you talk a little bit more about the public charge, specifically for those who are in the process of an immigration case and think that this will affect them?
So the question is about if you're in the process of an immigration case and how this might affect you. That one actually might be better handled through either APD or some other folks in our office. But let me just check if either of you want to touch on that. Okay, Michele can touch on that a little bit.
So we've been assured that nobody who needs testing or treatment for COVID will have that counted against them in their immigration case. And so people should not hesitate to get tested if they have been exposed or are feeling any symptoms. They should definitely get tested, and social security numbers are not asked for when you're getting tested. And if somebody is sick enough that they need hospitalization, UNM Hospitals provides that sort of treatment as our state's public health hospital to anyone who needs it, regardless of their immigration status and regardless of their insurance status. And so the hospital social workers will walk patients through the process of having that bill adjusted so that they don't end up with a bill at the end. But none of that should be counted against an individual for public charge purposes.
Okay, an unrelated question from Chris Melendez at GOV. Can you give your thoughts on Councilor Harris and Councilor Hassan's resolution that calls for the administration to start reopening Albuquerque's economy?
There's a question about the council resolution for us to look at different ways and start planning for reopening. And I think actually on this one, we are already doing that. So we got a good start on that Thursday, and we're in the process of doing that. So we're working on it, actually, with or without a resolution.
Okay, and then we have one from Chris McKee at KRQ. This is related to the CARES Act funding. Has the city received any further guidance about how it can or cannot spend the $150 million it's set to receive?
The question is about the CARE funding and the $150 million that we have received, but how we can use that. And so we have not received further guidance. It is Monday, and so I think we got the money last Thursday, I think. So we have been assured in the next few weeks we'll get some guidance, and our team is also working on what we think would make the most sense in the interim. So in a couple of weeks, we hope to have that question answered.
Another one from Chris McKee at KRQ. In the last 10 days, has the city received any other indications or changes about incoming revenue?
Question is, in the last few days have we received any other clarification or incoming revenue. The answer is there's nothing new to report on that at all. But as a reminder, we did get a chunk of money for transit. Again, this is separate. It has to just be for transit, a couple $1 million. And we did get about $10 million or so for the airport. So we're working through, again, what that money can be used for, et cetera. It does not help us with our overall budget, but it definitely helps with the aviation department's budget and also with transportation department's budget.
Okay. No further questions, concerns.
All right, well, I think we'll wrap things up. Want to give everyone a reminder that tomorrow we're actually going to have our telephone town hall. So it'll be at this time, and you'll see postings on social media if you want to join that and so forth. So tomorrow's going to be our telephone town hall, and then we'll be back Wednesday in this format. And also want to remind folks, the telephone town halls, historically, we've had anywhere between 19,000 and 14,000 people dialing in. So we've been able to accommodate tens of thousands of Braqueños on those calls. That's a good thing. I do want to mention that sometimes you have to call in a couple of times. So just, keep trying, and if not, we always post it after, so it's okay. But the volume has been so high that I know not everyone has been able to get through. But again, want to remind folks we're reaching almost 20,000 people a time on those. So lots of folks are able to get in. And hopefully tomorrow, everyone will be able to get in. Okay, with that, we'll talk to you tomorrow. Thank you.